Okay, future respiratory therapist, Griselda comes to me with a question talking about time constant. And as I look into this theory of time constant, I learned myself that this term time constant refers to the amount of time it takes the lungs to fully inflate and fully deflate. Okay, so you use this to determine expiratory time, maybe even inspiratory time needed to fully inflate, but then also expiratory time needed to fully deflate. I'm assuming to prevent air trapping. Now, I'm going to be real transparent with you here to everybody, including you, Griselda. I don't know of a program who teaches this. Now, obviously, I'm assuming you're in a program who is teaching this. That's why you asked the question. And so I would really like a lot of comments on this video. A lot of comments. I would like to know how it's being taught, why it's being taught, and how they're expecting you to apply it. Okay? That's my question. And here's why. Because I've been in the field for 20 years, and maybe this is just the region of the world that I practice in where time constant is not discussed. Like, we have no application of it at the bedside. I'm not saying we shouldn't, but I'm saying we don't. So I would love to learn from either an experienced respiratory therapist who uses time constant on a regular basis, because I've looked on the internet and I've seen lots of conflicting data. Nothing really makes sense. Nothing matches up. I see one formula that says calculate it like this. I see another formula that says calculate it like this. I do understand that it's a combination of compliance and airway resistance, but I don't really understand the application of it. And so I want you followers, you viewers who are watching this, who understand time constant, or at least have a basis knowledge or what your instructor telling you about it. I want you to share those thoughts with me, because this is very important to me, because if there is any element that I can learn that can further aid my students and further aid my own care at the bedside, then I want to. Okay, I'm having a real hard time with this topic. Okay, so I want to put that out there first of all. I am not an expert in this. I'm just going to give you some very basics to where if I was teaching it, this is where I would take it. Okay, so when it comes to time constant, we've already talked about the amount of time it takes to fully inflate alveoli versus, or even a percentage. I've seen where it's like one time constant is 66% alveoli inflated. Okay, I don't know how to apply that, but that's just what I've seen, right? So these time constants are in regards to full inflation and full deflation of the lungs, which tells me you're talking probably about how to prevent air trapping. And so when you're talking about air trapping, you want to be able to give a long enough E time. And I'm assuming that's where this comes in. How do you calculate enough E time to allow full exhalation? So here's what I've gathered on time constant. It's definitely not conclusive, and there's probably elements that I'm not going to touch on, but I'm going to try my very best to help you, Griselda, understand time constant. Now, if you think about it and you break it down, then what it's talking about is the amount of time it takes to inflate and deflate the lungs is time constant. And so that's what we're talking about. Now think about this. Your restrictive lung diseases create decreased compliances, and therefore they don't receive volume as well in terms of pressure. The pressure goes up much higher, much quicker with your restrictive lung diseases. So you inflate healthy alveoli much quicker because the lungs are stiffer. And then because of that stiffness, when you finish inhalation, they recoil back much quicker than their counterpart, which is an increased compliance disease process. Okay, so we're just going to say decreased compliance or restrictive lung diseases have a decreased time constant. Okay, now the opposite of that is if you have an increase in compliance or an obstructive lung disease, they have a higher time constant. That's because it takes longer to fill the lungs because they have no natural recoil. And then once you get them full, guess what happens? They don't recoil because they have a higher compliance, so they don't come back to normal. So with a decreased compliance or a restrictive lung disease such as pulmonary fibrosis, ARDS, pneumonia, atelectasis, any of those, you're going to have a decreased time constant. So your concern about a long enough E time, while it should still be there, is not as great because your E time, your time constant, is going to be much shorter than what it's going to be with an increased compliance or an obstructive lung disease such as COPD, bronchiectasis, cystic fibrosis, asthma. All of those are obstructive lung diseases, and that leads to a greater time constant because they have an increased compliance and an increased airway resistance, which means with this group, you need to be focused on a greater amount of E time because they can't get the air out. I think this is why this isn't touched on so much, because the physiology of the disease processes are kind of taught. And so if you've never heard time constant before, you've never calculated it, you still know that your COPDer needs a longer E time because it takes a longer time constant, unsaid, to get the air out. Your patients with pulmonary fibrosis, they're going to require a much smaller tidal volume. Why? Because it takes less time to fill those alveoli, which means if you try to put too much volume in, they're going to be at risk for barotrauma because they already have super stiff lungs. And so the decreased compliance and the restrictive nature of the disease process says you can't put much volume in me, but the volume you put in me is going to come out very, very quick. So you're not so concerned with your E time in this group of patients, your pulmonary fibrosis, your ARDS, your pneumonias, your atelectasis, because by nature, they don't have a problem getting air out. The alveoli are going to fill quickly because they're super stiff, and they're going to empty they're going to empty quickly because the lungs are going to recoil very hard because of the decreased compliance. Okay? So, that's really all I have to say about it. Like I said, I need lots of comments on this video. I need to know exactly how you're using time constant. I need to know the formulas you're using, the calculations you're doing at the bedside, and how are you applying this in your ICU at your facility. I would love to hear from you. I would learn to learn from you. Okay? So please comment. If you haven't done so, please subscribe. And while you're at it, watch another video. Hope you all have a great day.